on the face, we have to know what we would like to do. Volumize or, in contrary, drop down the fat. So every time when we will decide to do it, we have to think about genetics. Fat on the face, it is 100% genetic patterns. How our parents looks like, majority, the most of you will look like with aging. So when we talk about face slimming has to be to understand very well where you will inject it. So we will work with inferior orbital compartment, medial or lateral cheek compartment, and the nasolabial compartment. The most specific for the aging, for the woman especially, it is jawline. So another one would be focus of jawline. Every time we have to know where we are, because when we work with the product, we will work with not only the fat cells, but around fat cells you will have vascular area, you will have nerval structure, you will pass through the skin, so it's different. One little remark about massa bichà, because a lot of patients, they would like to remove bichà and to be very slim. It's not every time successful, and with age it could be a little bit excessive aging. So we have to be very careful when we are working with the face. With injections we have not this possibility as a surgical, but anyhow precaution can be. So fat on the face has several roles. One it is positive and another one negative. Majority of us finally will choose fatty face instead of slimy face after 55. This is very strange, but it was one study done by checking how patients look like and what the people like. So fat is good, but on the correct place. So expectation of the injectable slim program, it is to little bit modify the proportion, to make the down part of the face less heavy, to be less folded, and to finally take out double chin. For such a complicated things, we need to find a product which could achieve such target. We will work with the three targets. It is reduce adipocyte presentation by killing adipocyte or by increasing metabolism of adipocyte. We absolutely have to take care about immediate local inflammation, because every hour treatments little bit destructive with negative power, and we have to improve macro circulation and blood circulation. So in RRS, we have a lot of product, but the focus of today would be product RRS Cellutrix, which is medical device class 3. In fact, this product was done for injecting on the cellulite area, but with time, we understand that we can also try to inject on the skin and on the fat, not only on the body, but on the face. So it could be good. And the second product which we will talk, it would be pure off-label, it is Sagoni. So Sagoni, it is sterile solution containing deoxycholate and 5 another active ingredients, which is not, unfortunately, drugs, not unfortunately medical device, but working very well. So when we go on with a medical device, we have to perform a lot of study, which is explaining how the products work. And one of the studies was done in University of Barcelona together with the researchment center of a company which is developing this formulation. And they take a look different ingredients and see by the dry content how many triglycerides we can measure. So in fact, Cellutrix and Sagoni in two formulations, one with desoxycholate, another without desoxycholate, have very high activity to be effective on the fat reduction. In the Cellutrix, that is a combination of active ingredients, so that it is really working something. That it is a patient, which is a classical patient, which you would like to treat with a face slimming. And it is a technology which you apply, so you would like to focus injection inside of the problem area. When we find the area, we have to know how deep we can inject. So how deep we can inject a product? Normally, we have to inject it in hypodermal level. But if you make a mistake, it's not a problem, because you can improve also subdermal level. And the product Cellutrix, the majority and the safety of this product, because it's three-level product. You can go on the fat, you can go on subdermal, and you can treat it intradermally because it's low risky for any necrosis, no risk at all. So that is a good option. But once again, level of correct treatment of the fat has to be hypodermal. For that one, you will take a needle, which is 30G or 27G needle, mesotherapeutical, 13 millimeter. Don't take less length of the needle because it would be not useful for you. And you can absolutely easy manipulate with injections. So when we are doing injections and we are focusing on some problems, majority of the specialists will start to treat jawline because any patient could bring us flaccidity and excess of the fat on this area. So you can work with the Cellutrix with a quite big volume of, in one vial you have 10 milliliter, but at the same time you have to take care about skin flaccidity because the skin starts to drop down immediately in 1 week. So we very often combine with another product to tense the skin. Result which appear would be quickly appear, so you have to take care about it. We also can make a lot of similar activity like we are doing in surgery. So when you have a cannula or you have a needle, which is hard needle, which is impossible, you can make injection on every fat compartment together with a, traumatized technique to make a chemosis, to make a break the cells. This could help us a lot. We are working with malar fat, we are working with the jaw lines, and you can traumatize. Sometimes we can say, if you don't get hematoma, maybe it is bad, because with hematoma, you have easy to reduce the fat volume which you damage, and it would be much more profitable for the patient. If you work with the cannula, you can use 10 milliliter of the product only per one side. Because with cannula you will do long attraction and you will drop product more in surface much more excessively. So it would be also could be expected the better result. When we are talking about slimming face and long-term relation looking after our patient, it could be very interesting to follow up with the premenstrual syndrome. The patient who has huge edema in 5 days before period, they're very sensitive for the water retention. The product which we will use, we could help them for increase the water retention. So malar fat reduction, it is also very popular for injections. So you need to know where you will inject the product. I will not show it today, but you can see it. It's quite simple. The quantity of the product which you inject in one treatment have to be approximate. You can start from 1-2 milliliter and reach 3 milliliter, but not more. It is low risky, and effect would be immediately in 24 hours because of the water retention. And only secondary effect would be related to the decreasing of the fat compartment. So it's every time balance between understanding how the product works, in which moment effect will appear, and how you can express yourself and explain what the patient could wait after the first treatment. So this is very simple treatment. It is take 5-10 minutes. The product also is safe, so very often the practitioner combine the treatments on malar fat together with another area to economize the volume of the solution and to make the treatment more profitable for the patient. So can we go down in this one? So result on the treatment of malar fat is quick and not reliable for a long time. Normally, in 2-3 weeks, the patient would be back with the same symptoms. Unfortunately, you cannot say that it's a long duration because mostly we are working with water retention. Young patient is very happy because that position of the malar fat is genetically predisposed, so they need to find the help. We can also drop down the area around orbicular area if the patient very quickly increase the volume of the fat in complete body. We also could help a patient after surgery who has disposed the fat, and let's say it could be done extremely quickly, and they are also very happy with the result. The second product which I will show today, it is Sagoni. It is sterile solution. The composition of this product, it is deoxycholate, carnitine caffeine, methylsalinol monoranate, and the group of vitamin B. So it is first maybe formulated product with composed to propose fat reduction together with increasing of the draining effect. We are working with molecule of deoxycholate, which is not selective killer of membranes. We are working with L-carnitine, caffeine, and the majority of indication, it's only injection on the double chin. So you have to be careful with volume and with the depth. You cannot make injection, let's say, on another area. You have to be sure that you perform injection on the fat. When we choose the patient, you have to first be sure that the patient has double chin. You have to find the first injectable points, because on the first injectable points you will distribute the biggest volume of the product. And if we can see it, can we see it? Yeah, just I don't know. No, can we play a video? The treatments also for double chin is very simple, and the most product you have to inject on the area which you handle with your 2 fingers. And when during the treatments you cannot go away, because it's your security that you make injection exactly on the fat area. So in total for double chin injection you cannot increase more than 3 milliliter volume of the product, because more than 3 milliliter volume can put you in danger, since deoxycholate is not selective membrane killer. The treatment, it is easy to perform. At the same time, the patient could feel light discomfort during maybe 30-40 minutes. It will be not big edema compared to phosphatidylcholine injection or deoxycholate pure injection, because it is with another ingredients which is improving blood circulation and reducing the water. So in fact, it would be less edema compared to another product which you use. So for patient, it's a big advantage, because they are not need to cover that area. And result, when and how we can expect result. So when we make injection of this product, it's very similar to atomic exposure. So with atomic exposure, you have epicenter, which is you kill the cells, and after it's go moderate damage, severe damage, and in fact it's go in balance. So everything would stay with a pink color would be destroyed, and what everything would stay in yellow color would be reconstructed. Together with soft fibrosis. So what we can expect after one treatment? Very light changes. The treatment has to be performed once in 3 or 4 weeks, not more often, together with a cream, because we give a cream to the patient and they use it with a soft massage every day, morning and evening, slightly, for make it tensing the skin and reduce negative sensation. If it is a 4 treatments, once in 3 weeks, 4 weeks, it's already better, and the result would be very stable. If the patient wants to go more, you have to be very careful, because maybe it is not what the patient expected. Maybe it's necessary to put more skin lifting compared to a fat reduction. And you cannot drop down the patient with obesity. You also will take them to treat, and it's no age limitation, so every patient could be, let's say, accepted for the treatment. Today we have a patient which started such a treatment 1 year ago, and we will show how she was 1 year ago, and she's very happy why she asked to be, after this period of time, also model. Let's go on with the master class. So let's go on. So one year ago, yeah, we can make a focus on the screen. Just wait. After I can move, yeah. Oops. like this. So 1 year ago, we was like that. And we have another picture, yeah, front. Yeah. Okay, we was like that. And it was, for me, a big decision to finally to make injection, because, you know, sometimes when it's only here, it's okay, but when the full shape was round, I was thinking, oh my God, and it is aesthetic sources manager, how I will do it. So now, after 1 year, we can ask how it was finally, and it was very good. And we repeat once, I think, right? We make one repetition. So it was the first year. This was 1 year ago, like that. After we did one treatment more. Okay. So we did several treatments during the full year. And now every time I ask patients how do they feel, because after first treatment, they will say, oh, it is softer. After they say, okay, we see finally the shape. And after they say, okay, oops, it's go up. This is what we want. We want to drop down the double chin. We understand that we cannot drop down our lifestyle. So we are as we are genetically organized, but we would like to be nice and pretty. So to be nice and pretty, we have to decide what we will inject. In fact, we was agreed because we'll have two patients. One patient for Sagoni and another patient for Cellutrix. Cellutrix, the tactic is very similar. Cellutrix, you find the first point. This is the first point. The most maximum out point. After you do 1 centimeter approx left and right. Why 1 centimeter? Because when you inject some quantity, you have area of diffusion. So this is the area of diffusion. For not be too much cross with area of diffusion, you have to keep a distance 1 centimeter approximate. So it is like in chess. So 1, 2, 3, and after between 1 and 2 points, 1 centimeter up, 1 centimeter up, 1 centimeter down, 1 centimeter down. That is a classical scheme of injecting in double chin. Sagoni, Cellutrix, this is a classical point. After that, you drop down your left hand and you are sure that you will lose understanding where you are. That every time help you to get a fat little bit excessively pushed up, so you can be sure that you're not injecting in platysma. Because if you inject in platysma, the patient will keep pain and some uncomfortable sensation during period of time. Not with Cellutrix, with Sagoni. With Cellutrix, everything will be smoothly. Another point, every hour patient would like to drop down this area, exactly this area. So if we take a Cellutrix, we go this way, for example, and we break subcutaneous fat. We have to break subcutaneous fat, so you have to be a little bit aggressive. It's not really painful, but if the patient sensible, we can add a little bit lidocaine, or we can make injection of lidocaine before. It's up to you and up to the patient. Normally, I don't make with lidocaine. Sometimes, when I see the first patient, they are afraid to do, so I do only 2 points of injection, 1 and 2, for the start of the treatment. Not go with aggression, to go with gentle application. What will give you result? Aggression. What give you possibility to go with more session? Gentle. So it is a balance. The balance you decide by yourself. So we go on with injection of Cellutrix, RRS Cellutrix. Why we choose Cellutrix? Because in fact we already drop a fat down. Now we need to increase metabolic activity inside of the compartment, and we need to little bit tense the skin also. So we go on with injection. To make injection, well, you can use any type of the syringe. To make syringe out, of solution, I use normally very big needle to make it easy and quickly. The product doesn't contain parabens, doesn't contain any protective ingredients, so be careful. Once open, vial cannot be kept, so you have to use it till the last drop, because if you will keep it in the fridge or if you keep it for 24 hours, after that it would be not sterile anymore. So you will put in danger your patient and your reputation, and reputation of the product as well. So don't do it. Oops. So I took 27G needle. So if we talk about aggression, how to perform aggression, you make entrance with the needle, and before you make injections, you make like, like in liposuction, they are making it. So you need to a little bit separate the skin, subcutaneous fat, so you need to melt the fat inside. When you do it sufficiently, after, in retrograde and retrograde pushing technique, you make injection. This is no any danger, so you can go on the surface exactly under the skin, or you can do very deeply, but don't make injection inside, because open your mouth, because you have to remember that you cannot go in full profundidad, full depth. If not, you will make a trauma. But you can make really in horizontal very easily. So I inject lightly 2 milliliter in one side. Okay, now I will ask to press for the minutes. When you put a finger inside of the mouth, after take care with these gloves, the best is, without any confusion, immediately change it. So how we will do injection? On another side, what means gentle injection? Gentle injection, it is very simple. It is much more simple than you think, because this would be a product which will work for you, not you for the product. Gentle injection without trauma, it is very simple. You make a folder, you make injection, and you simply infiltrate a product. So you make in 1 point till the 1 milliliter without moving. You only need to find correct depth of injection. So when it's done, press out. Again, you put a folder and you make slowly injection. If you feel that it's sufficient, you only change direction of your needle, like I'm doing now. You only modify direction of your needle. What is the difference? Risk of hematoma higher on the right side. Risk of trauma higher here. But with trauma, with trauma, we have better result, in my personal opinion, because I work with this product a lot, and I see when we can make a drop down the fat, it's better. So now injection on the double chin. Keep it here. Inside of one vial, we have 10 milliliters, so it's sufficient to make good injection. Needle. This needle is not very good for performing first treatment. Take care. This is too long. If you are not experienced doctor, I recommend it to take you classical needle. What is classical needle? Classical mesotherapy needle, it is this one. The length is different compared to which I took from the beginning. But with needle, with yellow, cap, you can't make a trauma. Be careful, because it's dangerous. So the patient could sit down, and you have to perform first injectable points. In the first injectable points, it is 0.5 milliliter of the product. After, you go left, 0.5. You stop press till you go away. I don't know how. You have to stop to press it. And regularly, you make injection of the product. After injection performed, you have to absolutely 100% verify how your product distributed. So you need to make a soft massage with a little bit pressure to understand where and how you inject the product. It is every time. It also doesn't depend Sagoni or the Cellutrix. It is everywhere. And that's it. So the patient has to come for the next treatment in 3 weeks. What she has to do, she has to take Sagoni cream and apply it, or Cellutrix cream, and apply it every day, morning and evening. Yeah? Okay, so we have a second patient. Thank you. The product what we will show you now, it is Sagoni. It is this one. Yeah, thank you. And I need the gloves. Yes, here. Yeah, and you can clean here. So also, when we are performing injection on the double chin, I don't recommend you to do it in horizontal position. Patient has to little bit sit down. It will help you to understand where you are injecting. Is it already with, no, with, this one.
Just clean it.
Yeah, just clean yourself.
She's got makeup on.
No. Before perform injections, we have to definitively, no, it's okay. Definitively clean it very well. So this is the second patient. What she has skin flaccidity because she starts to lose weight. So how we can help her? We can help her to drop down more the jawline, and we have to help her with double chin. Why we choose this product? Because we have to go quickly. She soon would be married, so we need to go quickly.
Please.
Yeah. So it's only decision about that. And to be velocity increased, it could be only with the oxyhalite presentation. So what we will do, we take the same syringe. We take a needle to make a syringe out. In Sagoni, you have only 3 milliliter. It is the minimum dose which you can inject per one session. The product is, the injection in fact simply not very sensitive, not painful, so you can be quiet. Injection, if your patient says that it's painful, it means you touch vessel and it would be hematoma. So once again, we make a folded the skin, we find first injection. Now only first injection points would be 0.5. Every other one would be 0.1, 0.2. Every time in direction of your needle has to be on the fat. You cannot go out during the procedure. You cannot leave your finger. You have to keep it together with keep going injection. So you cannot leave a patient. After when you finished, you make a soft palpation. And yeah. So you cannot perform with the Cellutrix a lot of injection. Here, impossible to do what I show for the first patient. Here you can do only 1.02, 1 centimeter up, another 0.02. It's maximum allowed with product containing deoxycholate. And it is low risk for injection. So once again, you make a folder in maximum up 0.2 and 1 centimeter up 0.2, and that's it. So that it is slim faces treatment, and sure you can work with this daily. So if you have any question, please come and ask. And also product you can find in the booth of aesthetic sources, and question in any website, RRS, Medinet, Skin Tech Pharma Group. Everybody is welcome to help you to start. Thank you very much.